The future of Americans' access to COVID vaccines face a major test next week at the Centers for Disease Control, because the CDC's Advisory Committee on Immunization Practices, or ACIP, lays out recommendations for which vaccines people can receive and who can receive them. They are meeting next Thursday and Friday, which is a very big deal. But HHS Secretary RFK Jr. has gutted career scientists from both ACIP and the Food and Drug Administration and replaced them with people who, shall we say, are less friendly to science, data, and, of course, COVID vaccines. And now some of those FDA officials are set to present data to the CDC's Advisory Committee that could be used to restrict vaccine access even further. The Washington Post first report and NBC News has confirmed that the FDA plans to present an analysis of data about adverse effects from the COVID vaccine that links it to the deaths of 25 children. Now, the data comes from a system in which totally unverified reports can be submitted by anyone. The reports are then meant to be investigated. But to kind of give you just a sense of that, take this example from back in 2004, when one doctor made a point about how easy it is to submit fake information by reporting to the CDC that after he got a flu shot, his muscles began to grow in size, his skin became green, and he turned into the Incredible Hulk. Now, the CDC only removed his report after he agreed to have it deleted, just to give you a sense. Joining me now to help us understand this all is Dr. Vin Gupta, a practicing pulmonologist and an MSNBC medical contributor. Thank you so much for being here. This is one of those things I get texts about asking me what this means. First off, explain to us why this reporting about the upcoming CDC advisory panel is being met with alarm bells, really, from many in the medical community.
Yeah, Jen, good evening. The concern here is that if you misutilize this data, which you did beautifully in the tee-up, the limitations of this vaccine adverse event reporting system, VAERS for short, we've been talking about this, Jen, for over 5 years, that if there's something wrong, if you're a patient, if you're a medical provider, you're noticing something wrong with, say, the administration of a COVID vaccine, say a day or two after your patient gets it, you can go, or you can encourage them to go to this website and fill out a report and describe what happened. But exactly also to your point, it's completely unstandardized what somebody's going to put in, what they won't put in. Well, people put in fake information, which is why in 2023, the Journal of the American Medical Association, specifically their pediatrics journal that publishes into JAMA, looked at 17 separate studies encompassing 12 million children between the ages of 5 and 11 that had data submitted in VAERS if they experienced, say, pain at the injection site or a fever or any number of things. And they looked, Jen, at this specific question. Is there something here? Are there serious adverse events? Did anybody die? And the answer was no. There's some local adverse events. Everybody had some pain at the injection site, but nothing serious, and everything resolved within a few days, as we expect.
It's such an important point because there's so much data that's been looked at, and people have been taking the COVID vaccine millions for many years now. This is the committee, of course, that several states, and it's one of the reasons it's so important, need the approval from before letting their citizens get access to the COVID vaccine without a doctor's prescription. It's one of the reasons why it's such an important thing to watch. What options, we don't know what they're going to do, but what options will people have going forward if they want or need a COVID vaccine if this committee restricts it further?
Well, I mean, to emphasize the point you just made, and then I'll get to what options exist. Exactly to your point, Jen, 16 states, basically, in which CVS and Walgreens operate, 16 states, they're not going to distribute the COVID vaccine because those 16 states, based on law, basically say pharmacies can't hold these vaccines. Pharmacists can't distribute them. The CDC doesn't have an endorsement from their advisory committees. To your question here, here in Washington State and across the West Coast, there's ways around this. Our state health officer implemented a standing prescription. So basically anybody that is 6 months of age on up can get the COVID vaccine if they want it. So you don't have to go through this barrier of needing a prescription, which we know is a barrier to care. I should also just note, Jen, everybody all the way on up to the FDA commissioner now, Dr. Marty Makary, have built their career, especially over the last 5 years, on skepticism to the COVID vaccine, and specifically overblowing adverse events like myocarditis, inflammation of the heart muscle because of the COVID vaccine. So this is them making good on the reason why they're in these positions in the first place. They built their reputation on this specific theme.
Dr. Vin Gupta, there's so much news going on, but I tell you, the things my family members, my neighbors ask me about are always things like vaccines and health and what does this all mean. So I'm so grateful that you could be here with us and help provide a little bit of information on what we know. We have to sneak in a very quick break, but we'll be right back.